Perfect. Okay, wait. Um, my name is Ava Breeden, and today I'm going to be presenting on borderline personality disorder, otherwise known as BPD. Borderline personality disorder, or BPD, is a complex mental health condition that has evolved in terms of diagnosis, understanding, and treatment. Its historical roots can be traced back to the early 20th century when it was referred to as borderline states or borderline psychosis in psychoanalytic literature. Early theorists, particularly Otto Kernberg and John Gunderson, played significant roles in exploring the emotional and cognitive struggles faced by individuals with BPD. Initially, the disorder was viewed as being on the borderline between neurotic and psychotic states. The diagnostic criteria for BPD, as we understand it today, were not formalized until the publication of the Diagnostic and Statistical Manual of Mental Disorders in 1980. Before then, individuals with symptoms of BPD were often misdiagnosed with other mental health conditions such as schizophrenia or depression. The term borderline initially reflected the belief that the condition existed on the periphery of psychotic disorders, and there was little understanding of its specific characteristics. With advancements in psychological research and clinical observation, the condition came to be recognized as a personality disorder, defined by pervasive instability in relationships, self-image, and emotions. Over time, research has shifted from a focus on psychoanalytic models to more contemporary evidence-based approaches that emphasize biological, psychological, and environmental factors in the development and treatment of BPD. According to the DSM-5, the main symptoms of borderline personality disorder are organized into 9 diagnostic criteria, of which a person must meet at least 5 to receive a diagnosis. These criteria reflect pervasive patterns of instability in behavior, emotions, and relationships, frantic efforts to avoid real or imagined abandonment. Individuals with BPD often experience intense fear of abandonment and may go to great lengths to prevent perceived rejection, whether through impulsive actions or controlling behaviors. A pattern of unstable and intense interpersonal relationships. This includes shifting between idealization and devaluation of others, resulting in tumultuous and often brief relationships. Identity disturbance. People with BPD often have an unstable self image or sense of identity, leading to confusion about their goals, values, or relationships. Impulsivity. In at least 2 areas that are potentially self-damaging, spending, sex, substance abuse, and so on. This impulsivity often occurs in response to emotional distress. Recurrent suicidal behavior, gestures, or threats, or self-mutilating behavior. Many people with BPD engage in self-harming behaviors as a way to cope with overwhelming emotions. Affective instability due to a marked reactivity of mood. Emotions can fluctuate rapidly, and individuals with BPD may experience intense episodes of sadness, irritability, or anxiety. Chronic feelings of emptiness. Individuals with BPD often feel a deep, pervasive emptiness or void, which they may attempt to fill with external validation or destructive behaviors. Inappropriate, intense anger or difficulty controlling anger. BPD is associated with extreme irritability or anger that may result in physical outbursts or verbal aggression. Transient stress related paranoid ideation or severe dissociative symptoms. During times of stress, individuals may experience paranoid thoughts or feelings of unreality or detachment from their surroundings. The symptoms of BPD significantly affect an individual's daily life and relationships. The intense emotional swings, fear of abandonment, and unstable self-image make it difficult for individuals with BPD to maintain steady, healthy relationships. For example, in romantic relationships, a person with BPD may exhibit extreme jealousy, unpredictability, alternating between intense affection and extreme anger or withdrawal. This can create a push-pull dynamic that alienates loved ones and often leads to relationship breakdowns. The fear of abandonment disproportionately the fear of abandonment can also manifest in a person's career or friendships. An individual might react disproportionately to perceived slights or miscommunications, leading to conflict at work or with friends. A well-known example of pop culture is the character Jade West from the TV show Victorious, who demonstrates several BPD traits, including impulsivity, mood swings, and difficulty with interpersonal relationships. Real life scenarios of BPD include individuals experience constant turbulence in their social life due to their emotional volatility. For example, someone might develop strong attachments to a new friend, but then abruptly sever the relationship due to minor disagreement, reflecting the unstable patterns of connection that characterize BPD. The development of BPD is influenced by a combination of psychological, social, and environmental factors. Psychologically, people with BPD often have difficulty regulating emotions, which can be exacerbated by early trauma or neglect. Childhood abuse, whether physical, sexual, or emotional, is a significant risk factor. Studies suggest that a history of childhood trauma or neglect plays a crucial role in the development of BPD. Social factors such as invalidating environments where emotions are disregarded, punished, or ignored also contribute to the disorder. This can lead individuals to have difficulty understanding and managing their emotions, reinforcing the cycle of instability. Environmental factors like chaotic family dynamics or severe instability during childhood also increase the likelihood of developing BPD. The loss of a parent or the experience of neglect can contribute to attachment difficulties and emotional dysregulation. From a neurological standpoint, there are several biological explanations for BPD. Brain imaging studies have shown that people with BPD often exhibit abnormalities in the amygdala, the region of the brain responsible for processing emotions. Overactivity in the amygdala combined with underactivity in the prefrontal cortex, which governs decision making and impulse control, may contribute to the emotional dysregulation seen in BPD. Moreover, genetic predispositions play a role in the development of BPD. Research suggests that individuals with a family history of mood disorders, depression, or substance abuse are more likely to develop BPD. The evolutionary theory posits that some of the behaviors seen in BPD, such as intense attachment to others or extreme emotional reactivity, may have been adaptive in evolutionary terms, helping individuals navigate survival in harsh social environments. Borderline personality disorder affects approximately 1.6% of the United States population. It is more commonly diagnosed in women with a ratio of about 3 to 1 woman to men. The disorder is often first diagnosed in adolescence or early adulthood. Individuals with BPD are at higher risk for other mental health conditions, including depression, anxiety disorders, and substance abuse. The severity of BPD can vary greatly. For some individuals, symptoms may diminish over time, particularly with appropriate treatment. However, for others, BPD can be a chronic, lifelong condition that requires continuous management. Treatment for BPD is multifaceted, often combining psychotherapy, medications, and alternative approaches. One of the most well researched and effective therapies for BPD is dialectical behavior therapy, or DBT, developed by Marcia Linhan. DBT combines cognitive behavioral techniques with mindfulness practices to help individuals regulate their emotions and improve their interpersonal skills. Cognitive behavioral therapy, or CBT, is another commonly used approach that helps individuals identify and change distorted thought patterns. In some cases, medications such as antidepressants, mood stabilizers, or antipsychotics may be prescribed to help manage symptoms, though they are not a primary treatment. Although they are not a primary treatment, alternative treatments, including art therapy and group therapy, can also be beneficial in helping individuals express emotions in a nonverbal way and build social support. The effectiveness of treatments for BPD varies. Research has shown that DBT can significantly reduce self-harming behaviors and improve emotional regulation. Long-term studies suggest that with consistent therapy, individuals with BPD can experience improved quality of life, though the road to recovery is often challenging. Medications, while helpful for managing symptoms like depression or anxiety, are often not a cure for BPD and should be seen as a complementary to therapy rather than a standalone treatment. It is possible for individuals with BPD to experience remission or recovery, especially with long-term consistent treatment. However, complete cure is not typically the goal. Instead, the focus is often on managing symptoms and improving quality of life. Research suggests that some individuals may outgrow the disorder or experience a decrease in symptoms as they age, particularly with early intervention. Preventing BPD is challenging, given the complex interplay of genetic, psychological, and environmental factors. Early interventions, especially for children who experience trauma or neglect, can reduce the risk of developing BPD. Programs focused on emotional regulation, family therapy, and childhood trauma recovery may help mitigate the development of BPD. Public health campaigns aimed at raising awareness about mental health, reducing childhood abuse, and providing early intervention services are crucial in preventing BPD and other personality disorders. In conclusion, borderline personality disorder is a multifaceted and challenging condition shaped by genetic, psychological, and environmental factors. While treatment is effective in managing symptoms, BPD often requires long-term care and support. With the right interventions and understanding, individuals with BPD can lead fulfilling and stable lives.